Hi everybody, it's Jenny from MedEd, your CNA instructor. So this video is going to go over some questions about your resident care procedures. So we have a little study guide here that I give my students in classroom. If you can answer these questions, you're at a very good start on passing the skills portion of your state test. Now obviously for the state test, a lot of it is performance. You have to do hands-on. But if you can answer these questions, you can do it hands-on, no problem. So what I'm going to do is read the question to you. I'll stop talking for a few seconds. Go ahead and pause your computer, answer the question, and then hit play and see if you got the answer correct. So starting with initial steps. You need to know these in order preferably. Your initial steps. A, ask the nurse about the resident's needs, abilities, and limitations. If necessary, gather supplies. B, before you go in, make sure you knock on the door, request permission. C, when you see the resident, call them by the name you prefer. D, identify yourself by name and title. E, explain what you're there to do, have them help if they can. F and G, find and gather your supplies. H, close those curtains, grates, and doors. And then your eyes. I'm going to wash my hands, wear gloves as necessary, and I'm going to use good body mechanics. Final steps. What are your final steps? You need to know those in order as well, preferably. Final steps. A, check resident's alignment, make sure they're comfortable. B, make sure the bed is in the lowest position, side rails is appropriate. C, make sure the call light and water are within their reach. D, ask them if they need anything before you leave. E, everybody deserves a thank you, so thank the resident. F and G, find and gather your supplies, lead them to company or facility policy. H, ask them how they want their hanging curtains, open or closed. And then I, your way out the door. I'm going to wash my hands. I'm going to do a visual safety check of the room and environment. I'm going to report unusual findings to my nurse, and I'm going to document. Next procedure, hand washing. How long should your hands be washed for? At least 20 seconds, and that's with soap, water, and lather. What temperature of water should be used? Warm water. Hot water can open up pores and cause irritation. List each area of the hands that need to be washed. Palms, tops of hands, in between fingers, and fingernails, thumbs. Next procedure, gloves. What should be done after applying gloves before a procedure? Check your gloves for rips, holes, and tears. Replace if necessary. What happens to the first glove when it's removed? It is balled up in the palm of the gloved hand. And where is the placement of your fingers and how many? 2 fingers, and it goes under the cup of the ungloved hand. Next procedure, PPE gown. When donning a gown, what is put on first, gloves or gown? Gown first, then gloves. And how should that PPE gown be removed? By touching the inside only. Next procedure, mask, PPE mask. During the procedure, when should a mask be worn? When the resident is in droplet precautions. Why and when is a mask changed? If it's been more than 30 minutes or it becomes damp. You have to change it this way. When it's wet and it's been more than 30 minutes, it's going to decrease the effectiveness of the mask. So that's why we change it every 30 minutes or if it's damp. And if you're wearing gloves, when is the mask removed? After you take off your gloves and wash those hands. Next procedure, falling and fainting. What is the first thing you do when you find a resident on the floor? You call for that nurse and stay with the resident. And what is the first vital sign you need to check? Breathing. We check for breathing first. Next procedure, choking. What are the two questions you should ask to determine if the resident is choking? Can you speak? Can you cough? If a resident is choking, where is the hand placement in order to do the abdominal thrust? Midway between the waist and the rib cage. And how long are the abdominal thrusts performed for? Until the object is expelled. Next procedure, seizures. After calling for the nurse and staying with the resident, what are 3 things that need to be done next during the procedure? First, put padding underneath the head, move furniture away. Next, turn the resident onto their side when the nurse arrives. And we need to loosen up the clothing, especially around the neck. What are 2 things you never do when a resident is having a seizure? Never try to restrain them and never put anything in their mouth. Next procedure, fire. Define race. R, remove the residents from the area of immediate danger. A, activate the alarm. C, close doors and windows to contain the fire. And E, extinguish the fire if possible. Next procedure, fire extinguisher. Define pass. P, pull the pin. A, aim at the base or the bottom of the fire. S, squeeze the handle. And the second S is sweep back and forth at the base or the bottom of the fire. Next procedure is oral temperature. Where is the thermometer placed for an oral temperature? Under the tongue, off to one side. And what is the normal range for an oral temperature? For the test, 97.6 to 99.6. Next procedure, axillary temperature. Where is the thermometer placed for an axillary temperature? In the center of the resident's armpit. What is the normal range for an axillary temperature? 96.6 to 98.6 for the test. And what is done to prepare the resident before placing the axillary thermometer? Dry the armpit. Make sure the armpit is dry. Next procedure, pulse and respirations. How many fingers are needed to take this pulse? 3 fingers. It has to be 3 fingers for the test. Where do you place your fingers? On the radial pulse, on the thumb side of the wrist. How long do you check the pulse? 1 full minute for 60 seconds. What 3 things are noted when you're checking that pulse? Rate, rhythm, and force. After counting the pulse, how are respirations checked so the resident does not know what you're doing? Pretend like you're taking the pulse, so you keep your fingers on the wrist while you watch the chest rise and fall. What 3 things are noted about respirations? Rate, regularity, and sound. And what is the normal range for pulse? 60 to 100 beats per minute. And the normal rate for the respirations, 12 to 20. Next procedure, blood pressure. How high is the blood pressure cuff pumped if the blood pressure is not known? Up to 160. How far up do you pump the blood pressure cuff if the blood pressure is known? 20 above the usual systolic reading. And what 2 areas of the stethoscope do you need to clean before using it? The earpieces and the diaphragm, which is the round part that goes on the arm. Next procedure, getting their height. To measure a resident's height while standing, which way does the resident stand on the scale? Facing away from the scale when getting their height. How is height measured if they cannot stand? Using a tape measure. And how is height measured if the resident has contractures? Also, using a tape measure, starting at the head, going down to the heels, measuring the height. Next, getting the resident's weight. What is done to the scale before weighing a resident? Zero it out, put all the weights over to the 0, or push the 0 button on your digital scale. When the scale is balanced, how is the resident's weight obtained? You move the bottom weight 50 at a time till the arm drops. Then you move it back. Tap the top weight until the pointer balances in the middle. If it's a digital scale, wait for the numbers to remain consistent and then document it. How is a wheelchair weight obtained?